What I really wanted to do is, the way this works is that if I have a patient that could be any one of you guys' patient here that needs to be intubated, and I'm the anesthesiologist, my hands are gonna be full. Cause I'm gonna be out here, I am going to be the one who is mask ventilating the patient. Okay, so I have no hands. So if I wanna intubate, I'm gonna be looking to you guys to get my equipment ready for me. So that's the goal here in just this next couple minutes, is for you to know how to do that. So first, somebody's gonna grab the crash cart. You guys know how to open it?
Yeah.
How? Show me.
Rip that thing off.
Pull. Show me. Excellent. Good job.
You must work out.
So let's go to the airways. Okay, these are NG tubes, which isn't really airway stuff, but this drawer says airways on it. Okay, here's nasopharyngeal tubes and oral airways, okay? But that's not what we want, laryngoscopes and blades.
Oh, ET tubes at the bottom.
Were there ET tubes
Right there.
in there?
Bottom, next
Oh,
one.
yeah,
Yeah.
next one down. Okay, we're gonna get to those. Let's start here. First thing you need for a laryngoscope, you need a handle and you need a blade. Now, these are all labeled on the side what they are. Math blades are curved, Miller blades are straight. And the difference is when you go in, the vallecula is the space just above the epiglottis. And I wish I had a picture for you, but this blade goes into the vallecula, and when you pull it up, the epiglottis comes up with it. Okay, and then you can see the cords underneath it. This straight blade, when that goes in, you actually pick up the epiglottis and hold it up. And these are typically used for pediatrics, and the math blades for adults. See the green tab? You have to match. See the green dot on the end. Now the other thing is, on the end, it'll say what it is. So if you have one of these, this is a Mac 3, but it says down here Mac 3, okay? It's really hard to see, but you don't have a labeled package, this is sitting free. That's how you find out what it is. And any anesthesiologist will be able to look at that and tell you what it is, because you know we just know.
How many different sizes are there?
Well, they go all the way from like 0 up to 5. And the pediatric ones will have like a 0, 0, 0, 1, 1.5, 2, 2.5, and then it hits 3, 4, 5. So I just brought this one to open up because I just want you guys to play with it. Okay, to put them on, you just hook this over here and pull. And then to open it up, you do that. And if you want, you always want to check it. You don't just, say, here to the anesthesiologist. And you always want to give it to the anesthesiologist like they're going to use it. So, don't hand it to me like that, or don't hand it to me like that. Okay, hand it to me like that, so I can use it. And it always goes in my left hand. So
Okay.
that's the way I want it handed to me. Now, sometimes, especially when they get older, if you pull too hard on them like that, the light will go out.
But what'll go on?
Light.
Oh.
Yeah, light will go out. So, yeah, you always have to make sure that's gonna happen.
Okay.
So I'm just gonna pass this around. I just want you guys to practice, taking them off and putting them on. Okay,
Excellent.
this one's a little tight, which is actually good.
Okay.
Okay, so you guys can just play with that. So, that's the laryngoscope. The endotracheal tubes will typically ask for a size. So different ones, this one has a size down here. Okay, it's the internal diameter that we want. See, it says 7.5 there, the big numbers. It also says, see, ID internal diameter 7.5 there. Now, one of these that I have here has it up here by the top. So sometimes they're down, that's down there at the bottom and at the top, so where you can find those. Now, what else do you notice about this thing? It's got this tangle around it, okay? So what we're gonna wanna do is take that off, because that's just not real helpful to have it tangled there. So when you take that, don't take it all the way out of the package like I have it, but leave it in the package so that it stays clean.
Detangle the little tube, but leave
Detangle
it
this
in.
around it,
Yeah.
leave it in. But then, the reason why I got this, because I wanted you guys to feel, these things come apart really, really easy. And if they're apart and it's in the patient, they're really hard to get back in. Well, so when you take it out, the first thing you wanna do is just cram it in there, okay? And now, it's not coming out so easy. It's a little more difficult. So I'm gonna pass this around so you guys can feel that. And also, you can kind of feel what it's like. If you have time, check the balloon. Blow it up, make sure it's competent, okay? But always end up taking all the air out. And when you take all the air out, we can get rid of this because we're just playing. It's really going to be scrunched all the way down like that. If you have time, put some KY jelly on it. Just dump a bunch on and go like that in the package, and you can try that. Now, the next thing, this is a stylet, which makes it easier for the endotracheal tube to go in. They look like this. There's some metal ones in here. There's a smaller one for peds. What we mostly have for adults is these right here. So I'm going to open this one up. And first thing you want to do is just straighten it. Okay, and the ones that we've had for a long time have all kinds of little ripples in them, but you should try to straighten it. In it goes. You do not ever want this to go past the end, okay? Because when it goes in, it can damage the cords of the trachea. So, because it's a lot stiffer than the tube itself. So I would rather have it back just a tad than in too far. So you don't want that, and that's not good, okay? And then, this being an 8, not a cut tube, usually it's longer than this, so I'm just gonna do that. You wanna bend it over, okay? Because then it can't go in further. It prevents it from going in too far. And then you want to bend it, and you want to make it look like a hockey stick. Okay, is that pretty good? Okay. When you hand it to me, I need you to hand it to me like I'm going to use it, which is like this. Okay, it's going to go in the patient like this. Okay, so the laryngoscope like this, and this one like this. Left hand for laryngoscope, right hand for the endotracheal tube. And if you just put it in front of me, because you can't remember which hand, I'll take it with the correct hand, okay? But just don't give it to me like this. That's not going to be helpful. Okay.
They need to be like 2 little feet sticking
That's
out.
right. Exactly. They both need to be going like that.
That's a good way to put it.
That's how the
Yeah.
only way I would remember that. 2 little feet.
Yeah. So anyway, I'm going to pass these 2 around. Just so you guys can feel what it feels like to take these out and put them back in. Now this one's in pretty snug already. There. So you guys can play and feel what it, just kind of get a feel for it.
Oh, we said to keep it in there, kind of unwrap this, make sure this is a snug,
Right.
so it doesn't come out while you need to
Exactly.
put it. Yeah.
Exactly.
And then
Exactly.
Check the balloon.
check the balloon.
If you have time-
KY, put some in
Right.
there in the bag.
If you don't have time for KY, you don't put it on. If you don't have time to check the balloon.
Now, should we have KY in the
Can't figure it
cart
out
then?
anymore.
That would probably be a good idea.
We definitely have some.
Yeah, that's probably a good idea, to have that. Now, the other thing, as soon as that goes in, we're gonna wanna listen, okay, so make sure we have stethoscopes, and I think there's one at every bed, so if we make sure those are always there, but just make sure that it's,
We
You
have
can
one.
locate one when you're
We have one in
needing
the
it.
drawer
Exactly.
also, just in case.
and
Like
then,
a nicer.
and then when the anesthesiologist is happy where it's at, they're gonna want, some tape, and typically we like to tape with pink tape, and so.
Pink tape?
Pink
That's
tape. Pink tape,
Where'd you get it?
right here.
Extra, just in case it's.
It's sometimes in the anesthesia workroom, if it's not, then it's way in the back.
Okay.
Do you have a phone you want to call up?
So, now just some, little tips to make it easier for us as anesthesiologists, what we're gonna be looking for. When we go to intubate a patient, if they're absolutely flat on their back, that doesn't give us a very good angle to look down to their cords. We talk about the sniffing position, like what do you do when you sniff? you're gonna sniff something, stick your head like that. Well, that's the position that we want the patient to be in because it gives a direct line of sight between the mouth and the cords. So, you know, we may want a pillow or some towels or something underneath the head. And if one position isn't working, then we change it. Maybe more towels, maybe less towels, maybe, you know, these are things that we're gonna try. So, you know, if you see somebody struggling, that might be one of the first things that you say is, you know, can I get you some towels, or can I get you a pillow, or can I, so that's helpful. Another thing that's helpful is sometimes just to pull up on the lip, particularly if a man has a lot of facial hair. You know, pull up on the lip, and that helps just get that out of the way, gives us a little better sight. The other thing, watch what the anesthesiologist does with the neck, because sometimes we have to move the larynx around. So if I have a hand in there with my laryngoscope, and I'm with my right hand, you know, moving the neck around, well, I've got a perfect vision there, but I can't get the tubing because I don't have free hands, and so I'm going to need the nurse to replicate what I just did. So what I'll say to the nurse is, okay, I need you to do that, and I'm pulling a little to the left or to the right, because sometimes they're even a little off center, or I'm pushing down a little bit. So a little conversation has to go in there, but if you kind of watch, you know, or maybe the nurse will put their hands on, and then I'll kind of move the nurse's hand, okay, now do that, and then don't move, and then I can take the tube and put it in. So those are just some ways, you know, things that you guys can do to help us. And then the only other thing that I want to say is a big help is if you're not sure what to do, just say, how can I help you? Okay, how can I help? Because me, for one, if I'm in a situation that's causing a lot of, you know, an emergency type situation, I tend to get quiet. I tend to not talk. I just tend to do. And I expect people around me to know what they're doing. And I don't just start shouting out orders. I just start doing. That's what I do. Other people are good at shouting out orders. So it helps to say, how can I help you? How can I help you? Okay, questions? No?
Nothing I can think of.
Okay.
Play with that little blade again.
Yeah. Okay.
All right, great. Thank you very much,
Thank you.
Dr. Springle.
Thank you. You're welcome.
All right.
Okay, this is all crash. Now, who's checking your crash card? Is it still Emily?